Pregnancy is this incredible journey, right? And like any big adventure, you're going to want a map. Well, that's what we're here for today, to give you a clear, simple guide to your antenatal care, every single step of the way. So, you find out you're pregnant. It's exciting, maybe a little bit overwhelming, and the huge question is, what on earth happens now? Well, think of this as your personal roadmap. We're going to break down exactly what you can expect from your antenatal care, nice and simple. Here's what we've got on tap. First, we'll nail down what antenatal care actually is. Then we'll walk through that all-important first appointment, cover some key lifestyle advice, and talk about how you and your baby are monitored. And we're going to finish on a really crucial topic, the disparities in care. So let's dive in. So what is antenatal care, really? It's so much more than just a handful of checkups. The best way to think about it is as a proactive health journey that you and your developing baby are on together. In a nutshell, it's the whole system of support, advice, and medical monitoring you get from healthcare professionals. It starts the moment you confirm you're pregnant and goes right up until labor begins. And the goal? It's simple, to keep you and your baby as healthy and as safe as possible. Generally, your care will follow one of two main paths. For most people with uncomplicated pregnancies, it's midwifery-led, which usually means about 7 to 10 appointments. But if your pregnancy is considered higher risk, maybe you're having twins or you have a pre-existing health condition, your care will be obstetrician-led. That means you still get all the midwifery care, but with extra appointments at specialized clinics too. Okay, let's talk about that very first appointment. And I mean it, this is not just some quick meet and greet. It's truly the cornerstone of your entire pregnancy journey. This first meeting is called the booking visit, and you could honestly argue that it's the most important appointment you'll have. Why? Because this is where everything gets set up. It's where your healthcare provider really gets to know you and your specific history so they can tailor a care plan that's perfect for you. So what actually happens at this booking visit? Well, a lot. You'll have a really in-depth chat about your health history. They'll run some blood tests to figure out your blood group and rhesus status, and crucially, they'll assess your risk for things like blood clots. But it goes deeper. They also do a holistic check-in on your mental well-being and screen for things like domestic violence. It's super comprehensive for a reason, to give you the absolute best care right from day one. All right, let's shift gears and talk about the stuff you can do every single day. This is all the essential lifestyle advice that helps you build a really solid, healthy foundation for you and your baby. Okay, 2 vitamins are basically non-negotiable, folic acid and vitamin D. Folic acid is absolutely critical, especially for the first 12 weeks, because it helps prevent neural tube defects. Most people take a standard dose, but some folks need a higher 5 milligram dose. And everyone is advised to take 10 micrograms of vitamin D every day to help with healthy bone development. So you might be asking, who needs that higher dose of folic acid? Well, it's usually recommended for people with certain medical conditions like epilepsy or diabetes, anyone with a BMI over 35, or if there's a personal or family history of neural tube defects. If any of this sounds like you, it's a super important conversation to have with your provider. Let's do a quick fire round on some other key lifestyle points. Food-wise, the big thing is to steer clear of stuff like raw meat and unpasteurized cheese. For exercise, the general rule of thumb is to just keep doing what you were doing before as long as it wasn't super vigorous. Now, when it comes to smoking and alcohol, the advice is crystal clear. Get help to quit smoking and avoid alcohol completely. And lastly, if you're traveling, just be mindful of the increased risk for blood clots, compression stockings are your friend, and always check the airline's rules. Okay, so once those foundations are set, the focus shifts over to ongoing monitoring. This is all about keeping a close, careful eye on your health and your baby's growth as the weeks go by. After you pass the 24-week mark, they'll start doing a key measurement at every appointment. It's called the symphysis fundal height, or SFH for short. Basically, a midwife or doctor uses a simple tape measure to check the distance from your pubic bone to the top of your uterus. It sounds technical, but it's a really straightforward and effective way to see if your baby is growing on track. But that tape measure isn't foolproof for everybody. In some situations, an ultrasound scan is just a much more accurate tool. For instance, they'll use an ultrasound if an SFH measurement seems a little off, if you're carrying twins, if your BMI is over 35, or if you have large fibroids, because all those things can make the tape measure method less reliable. Now listen up, because this is so important. After about 28 weeks, you'll start to get a sense of your baby's normal pattern of movements. If you ever feel like they're moving less than usual, here's exactly what to do. Lie down on your left side and just focus on their movements for 2 hours. If you feel fewer than 10 little kicks or wiggles in that time, you need to contact your maternity unit right away. Seriously, don't wait. Don't ever worry you're being a bother. Just call. For our last section, we need to shift gears and tackle a subject that's tough but absolutely vital. The MBRAC 2021 report from the UK uncovered some stark and frankly unacceptable realities about who is most at risk during pregnancy. The report makes it painfully clear that risk is not shared equally. It explicitly states that the risk of dying during pregnancy is highest for women who are dealing with complex social issues, things like being an asylum seeker or refugee or experiencing domestic abuse. But the disparity is also starkly racial. The report found that Black women in the UK are 4 times more likely to die during pregnancy or in the 6 weeks after childbirth than white women. Let that just sink in for a moment. 4 times. And it's not just Black women. As you can see from this chart, the risk for women of mixed ethnicity is 3 times higher. For Asian women, it's 2 times higher. These aren't just numbers on a page, they represent a profound failure within the system. And heartbreakingly, this tragedy extends to the babies too. The stillbirth rate for Black babies is more than double that of white babies. For Asian babies, it's 50% higher. And woven into all of this is socioeconomic status. Stillbirths are almost twice as common for women living in the most deprived areas. Look, we know that good antenatal care is one of the single most effective things we can do to save lives. The evidence is overwhelming. So the question we have to leave you with is this. Knowing everything we know, how do we finally build a system that serves and protects all lives equally?